Let's go to Robert in Mobile. You're on Winning at Life with Gregory Ricks. How can we help you, Robert?
Good evening. I'm 62 and a half, and I've reached the point where I just don't want to do it anymore. Physically having issues, and I'm ready to throw in the towel. The problem that I've run into is, what do you do about medical insurance after you retire? I have a small pension, and I'm going to be on Social Security. I will be probably getting another job just to have something to do.
You've had it, called it a day. So what kind of monthly income are we having right now?
Well, I haven't quit yet.
Okay.
I'm waiting on some information. The company that I'm with years ago was taken over by another company, and at that point, I had a pension. It's sitting out there and waiting on the paperwork for it to see exactly how much that's going to bring in.
Okay.
Plus Social Security.
So we're talking about starting Social Security early then. So there's this being done is with working in general. You don't foresee yourself going and doing something else.
I will be doing something else.
Okay.
Probably not as a mainstream income that I'm making now.
Yeah, turning on Social Security at age 62 kind of limits you to non-penalized income. So if you go pick up some other income, you kind of need to keep it under $18,240, or else they're going to take some Social Security back from you. You do understand that, right?
Yes.
Okay.
Yes.
Health insurance, I'm going to tell you, I think I've not priced it today, but I've talked about it and have this conversation often. It's probably going to cost you more than $1,000 a month.
Wow.
Yeah. That's kind of what the
Mine
expectation
right now is
should be.
Catastrophic only, though.
Yeah. And I'm speaking of that you probably go pick up something. You need to have some emergency money. You could get a HSA type plan, which is a high deductible also. And that means you're going to have to kind of pick up the bill. How is your health, Robert?
Great. No issues.
Okay. That is good to know. From expectation is, can you get through the next 3 years until you can get on Medicare? And Medicare has a premium, and then you're going to need a Medicare supplement or utilize Medicare Advantage HMO type program of the government, HMO, on that. So there's still going to be some premium there, but probably will be reduced from what you're going to have to pay. And one of the things is shop around a little bit. And this isn't a bias towards anybody. There's a bunch of insurance companies out there, but you could, maybe start calling Blue Cross, or, go online, one of the search engines, and just kind of look up for prices at your age. But this is a decision that affects because there's a lot of people that, they're done, but they've got to keep going till 65 just because of the health insurance impacts them that much. Being you're starting they have to wait to 65 because then they start with Medicare. This affects a lot of people that they're not going to retire, even though they're had it. The health insurance is causing them to continue working because of its cost. Could this be a game changer for you, that you got to keep working?
It could. I've got to wait and see what this pension's going to bring in. I only make $45,000 right now, so I'm not, in some high category.
Yeah.
But, and I'm comfortable enough with that. But I don't want to have to live on $20,000 either.
Well, you know what what pensions are kind of called. I just pulled this out back in my brain from back in the day. It's half of what you couldn't live on to begin with, is what a pension is. So, and then Social Security. So you have to think about that. Just don't quit this job. Start tomorrow or this evening. Go do a little bit of searching on, the healthcare costs out there. I don't want to see you in a bind, and you can be in fine health. And, I am in great health. I do these checkups every year and, do the heart tests and I'm super proactive. A lot of people are dependent upon me staying in good health, staying around, helping look after their money and so forth. So I think that's really important to make sure I maintain my health. So last year, not this past physical, but the previous year, sit down with my doctor and he says, you got some problems there. There was something, my calcium was out of whack. And we had that before, but it came back in line. And actually, this was the year prior, actually. And I said, well, we should be able to get, he said, well, let's do some more tests. And then I want you to speak to the specialist, a surgeon also. And it's going to entail an operation that's real close to your vocal cords. I said, well, I am not on board with that. Well, what I found out when I talked to the specialist, he says, yeah, if this continues, your life's going to be dramatically short and your bones are going to be brittle and all that. So he scared the bejeebies out of me. And he said, well, there's the other tests we want you to do to see where you are on this. And I remember landing in New York and there was a voicemail for me. And he basically left voicemail that I'd met all the criteria for the surgery and I needed to have it. So it was kind of disturbing. Somebody that's in really great health, feels good all the time, like I've got something that's going to shorten my life if I don't do something about it. So what I'm getting to you, everything can be going good, and then all of a sudden something in your body starts changing. So about 60 days after that, I had surgery and it solved the problem. Because what also got my attention, I started having dadgum kidney stones every couple weeks that would put me in the ER to stop the pain. And man, health insurance is really good when you have a situation coming up like that. So I don't take this decision lightly just because you're in good health to try to make this run for 3 years without health insurance. I'm serious about that, Robert. Be careful on this decision going forward. Good luck to you, brother.